Injustice in healthcare, a struggle for African Americans. In 2021, a young woman named Nia Justice was in extreme pains after having a surgery to remove her gallbladder. She contacted the surgery team who performed her surgery and expressed to them her symptoms and unusual pains. The doctor and team were very dismissive and had no intention on helping her and running tests. It took her having to contact her primary care physician for her to receive treatment, be healthy, and diagnosed septic. This is not the first instance where African Americans had to suffer due to discrimination and racism that is so evidently rooted in the healthcare system. The health of the African American community has been researched, protested, and constantly debated. Yet there is little to no improvement on discrimination and racism that is so evidently rooted in the healthcare system, as seen in my previous slide. Johan Norberg, a senior fellow at Cato Institute, identifies in his article, False Nostalgia, that people in history tend to remember the good old days and push away the trials and tribulations that we face as humans and as a society. This causes many African Americans to feel neglected and unrepresented within the healthcare industry. In what ways can this be improved on, and why is discrimination and racism so evidently rooted in the healthcare system? This leads me to my first problem. Historical causes of mistrust. During the era of slavery, numerous surgeries and procedures were constructed on African Americans, particularly women, with little regard to their mental and physical well-being. These procedures were often performed without anesthesia, reflecting the brutalizing and abuse that many endured, highlighting the extreme lack of care and ethical consideration in the medical practices at that time. Anarcha, Lucy, and Betsy were three enslaved women who were experimented on by Dr. J. Marion Sims in the 1840s in Montgomery, Alabama, without consent or anesthesia. While Sims gained fame and became known as the father of gynecology, the women were left to fade into history despite their significant contributions to the healthcare industry and healthcare system. This example underscores African Americans, enslaved individuals, and people of color who endure immense suffering without receiving recognition for their contributions to the development of the healthcare system. Judith Bendy, professor of history at the University of Auckland, identifies in her article that there will always be two sides of the story which offer different approaches in recording and understanding history. While some argue that this issue has been addressed and that the experiences of African Americans have improved in the healthcare system, yet acts of discrimination are still evident. Although progress has been made, healthcare professionals are still not correctly educated on providing equal care for all patients, which leads me to my second problem. Higher medical costs. But higher healthcare costs, I changed it. African Americans do not have the same opportunities as white Americans when it comes to social participation, jobs, and access to affordable healthcare. This disparity directly impacts their ability to manage healthcare costs, access to resources, and lower medical bills. As a result, many African Americans face crushing medical burdens, making it difficult to pay for medical care or even basic living expenses. Rising medical debt not only harms the financial stability of individuals and families, but also affects their credit scores, which makes it nearly impossible for them to secure loans, buy homes, and even quality for insurance. Racism and discrimination plays a substantial role in this disparity. While the Affordable Care Act, also known as ACA, was signed into law to provide insurance coverage and reduce medical costs, only 1.5 out of 10 African Americans benefit from this coverage. This leaves the majority of African American communities struggling to manage medical costs with limited options for financial relief. The result of these systemic inequalities is devastating. Not only does this lack of support drive African Americans away from receiving necessary medical care, but it also contributes to a higher mortality rate within the community and a lower life expectancy overall, which leads me to our last and final problem. Elevated death rates. For years, the disparity in death rates between African Americans and white Americans has been a long-standing issue. While environment factors and communities may contribute to a higher death rate, the healthcare system is failing for African American communities. According to Andis Robuscus, a senior news fellow for AMA, on average, more than 74,000 Black American deaths are due to injustice and neglect they receive from the healthcare system. Black women are 3 to 4 times more likely to die from pregnancy-related complications than are white women, a clear example of discrimination and systemic racism, as stated by Julie Hunt Potter, CEO of Hunt and Gaither, a marketing and communications firm. Despite public outcry and data, no major law has been enacted to protect African Americans from these biased practices. This failure results in worse healthcare outcomes, increased mortality rates, and a lower quality of care for African Americans. This chart shows a maternal mortality rate from Black women from 2018 and 2021, which shows neglect and lack of care for Black women despite the elevated mortality death rates. Now for my solutions. There are many solutions and implementations that can be made and put into movement to improve the experiences of African Americans in healthcare. But due to research and study, these 3 solutions have a higher chance of success. My first solution is a diverse workforce. A diverse workforce would reduce discrimination and biased practices and experiences for African Americans, a greater representation and voice for the African American community, an increased sense of belonging. A diverse workforce would improve patient care, especially for African Americans, and create a safe space for acceptance and less judgment. This will allow patients to feel safe and express how they feel, knowing they'll be treated fairly. My second solution is enlightening HCPS, also known as healthcare professionals. Educating HCPS would address health disparities, improve treatments for African Americans, and recognizing historical trauma. According to Dr. Lambert, a board certified in family medicine, educating HCPS on the problems and issues that affect African Americans are proven to increase and influence the health of African Americans and trust in the healthcare system. My last and final solution is medical support programs. Medical support programs would improve access to care, insurance coverage, and addressing social risks. Medical support programs would decrease medical debt, help African Americans with medical coverage, and receiving fair treatment within the healthcare system. An example of this is NMA. NMA is one of the oldest and largest national organization one of the largest and oldest national organizations representing African American physicians and their patients in the United States. By having a support system, it creates a voice for the African American community that has been seen less than and silenced for generations. Now for my counter argument. Some people argue that African American health disparities are primarily due to lifestyle choices such as poor diet, lack of exercise, and smoking. Focusing solely on individual health outcomes overlooks systemic and structural factors contributing to health disparities, including access to quality education, safe environments, nutritious food, and healthcare. Thank you for your time. Here are my citations.